Common risks in phlebotomy. Common risks. Patients fainting. Patients can come into the department and be fine whilst they're sat in the chair, and then all of a sudden they become hot, anxious, they're slightly dehydrated from fasting for 12 hours. If it happens, you need to make sure you remove the needle safely but quickly and discard of it to reduce the risk of needle stick injury. Make sure your patient is safe. Make the area cooler. If needs be, shout for help and get the patient medical attention. Unable to obtain the sample. This happens to all of us, whether you've got 3 days experience or 13 years. But what you can do is ask your colleague to have a look at your patient. Generally, phlebotomists have 2 chances to bleed a patient. If you're unsuccessful, your colleague can have a look. Bruising and haematomas. Bruising, unfortunately, can happen as much as you try and avoid it. But we do say to reduce bruising, make sure pressure is applied to the cotton wool once the procedure is finished for at least 2 minutes. Patients vomiting, unfortunately it does happen. Just make sure they're comfortable afterwards, maybe a drink of water, and then send them on their way. Patients dehydrated. This happens due to the fact that some people just simply don't drink enough on hot days, also through fasting for the blood test. Excessive bleeding. Patients that are on anticoagulant therapy bleed to an excess. This is because the medication they're on thins their blood and makes the time for it to stop longer. So pressure needs to be applied to the site for longer than the 2 minutes for standard patients.